Okay, this is my audience.
Okay, my speech today is on the Heimlich maneuver. Have you ever swallowed a spaghetti noodle wrong, gotten an onion ring caught in your throat? I'm sure that everyone has choked at least once. Wouldn't it have been nice if someone there would have known how to do the Heimlich maneuver and could have helped you out of that situation? Choking occurs when a foreign object becomes lodged in the throat or the windpipe, blocking the flow of air. In adults, a piece of food often is the culprit. Young children also swallow small objects because choking cuts off oxygen to the brain. Administer first aid as quickly as possible. The universal sign for choking is hands clutched around the throat. If the person does not give the universal sign, then you should look for the signals. Some of these include an inability to talk, difficulty breathing, or noisy swallowing, skin and lips and nails turning a blue or dusty color, and loss of consciousness. If choking is occurring, the Red Cross recommends the 5 and 5 approach to deliver first aid. First, deliver the 5 back thrusts to the person's shoulder blades or with the heel of your hand. Next, prefer 5 abdominal thrusts, also known as the Heimlich maneuver. You should alternate between these 5 and 5 blows before the blockage is dislodged. To perform abdominal thrust or the Heimlich maneuver on someone else, stand behind the person, wrap your arms around their waist, and tip the person forward slightly. Make a fist with one hand, position it slightly above the person's navel. Grasp with the fist in the other hand. Press hard into the abdomen with an upward thrust as if trying to lift the person up. Perform this a total of 5 times. If needed, the blockage is still not dislodged, repeat the 5 and 5 cycle again. If you're the only rescuer, perform the back thrust and abdominal thrust before you call 911 or your local emergency number for help. If another person is available, have that person call for help while you perform first aid. If the person becomes unconscious, perform the standard CPR with chest compressions. If you're alone and choking, you'd be unable to effectively deliver back blows to yourself. However, you can still perform the abdominal thrust to dislodge the item. To perform abdominal thrust or the Heimlich maneuver on yourself, place a fist slightly above your navel. Grasp your fist in the other hand and bend over a surface or a countertop. Shove your fist inward and upward until the airway is dislodged. Position your hands a little bit higher with a pregnant or obese person at the base of the breastbone or just above the lowest ribs. Proceed with the Heimlich maneuver. Repeat until the food is dislodged or the person becomes unconscious. Clearing the airway of an unconscious person is also a little different. Lower the person to the floor. Clear the airway with your finger if the item is visible. If not, perform CPR as earlier recommended. Clearing the airway of an infant or a younger adult, younger than age 1. Assume the seated position and hold the infant face down on your forearm, with the child resting on your thigh. Thump the infant gently or firmly 5 times in the middle of the back using the heel of your hand. The combination of gravity and the back thrust should release the blocking object. Hold the infant face up in your forearm with the head lower than the trunk if this doesn't work. Using 2 fingers placed in the center of the infant's breastbone, give 5 quick chest compressions. Repeat the back blows and the chest thrust. If breathing doesn't resume, call for emergency medical help. Begin CPR on the infant if these techniques open the airway, but the infant doesn't resume breathing, the child is younger than 1, then 911 should be called immediately. If you ever see someone swallow spaghetti noodle wrong or get an onion caught in their throat, know that you could help. Today I have taught you how to do the Heimlich maneuver, so next time you see someone in this situation, you can help.